Thank you.
Okay, so I'm speaking on your monthly theme of supporting parental journeys, and I'm here from National Children's Bureau, where I've worked for about 7 years. It's a national children's charity, geographically located in London and also in Northern Ireland, in Belfast, and works across the UK, but mainly in England. Mainly in Northern Ireland, little bits of work elsewhere in Wales and Scotland and in the Channel Islands too. And occasionally we do something international, but that's pretty infrequent. It's more just speaking and contributing to wider sharing learning rather than any of our sort of programmatic work. So this is what I'm going to cover. Bit about us. We have something called the NCB Family that I hope will resonate with you. It's the principle of together we're better, and therefore we have our working in partnership approach with other agencies. And parts of NCB are the family, even though they're still part of our charity. So we have different front doors really for people to come through. I'm going to talk specifically on some issues impacting on child and family wellbeing during the pandemic. Now, I'll also make reference to other things because there's some consistent themes, but they're becoming more prevalent or more to the fore during the pandemic times. Then I'm going to talk about the role of parents, and really it's what can parents do to make childhood better, and particularly around mitigating some of the really negative stuff that's happening at the moment. And then I'll wrap up just with a quick sum up of what we're asking of government. And when I say asking of government, it's what we're also, it's a bit like a rally cry, what we're asking of others to join us in promoting and campaigning for too. So we're a national children's charity, been around since, 1963. So it's a long established charity and started out as a research place. And lots of local authorities around England all chipped in some money to get NCB going into a network that really brought together people that were interested in early childhood. From councils. So whether they were interested in early childhood or children's social care or disability, a focus was through NCB, and they all chipped in membership fees, and that was part of the business model. Started out as a research place, but then grew as this membership organisation. That changed with the local authorities over time, but something that we've always done is when there appears to be a gap, is working together with all of the partners that we work with. And we call people that are agencies, other professionals, individuals, organisations, we call them partners. That partners agree that NCB will be a good place to host something. So the Anti-Bullying Alliance, we worked with NSPCC to set that up. Childhood Bereavement Network, we worked with a whole alliance of organisations working with hospice movements and with a whole range of services. Council for Disabled Children, that's one of the first NCB Family membership groups with its own identity, and that's been going back considerable time. It really is known as the main umbrella body to bring together a number of organisations and professionals, and also to be a good point of contact for parents' information too. And then a very important partnership, I haven't got them all here, I've tried to list the main ones. We do have the Sex Education Forum, which since the implementation of statutory relationships and sex education by the government is taking a bit of a different direction. And they're actually just established their own independent charity. So we're saying goodbye to them as they move to be independent from the end of next March and do their own thing. The Lambeth Early Action Partnership is a significant one that you may be interested in, because this is one that brings together statutory agencies. So Health and the Council in Lambeth are very much part of this, but they're equally there with parents, communities and children's voluntary sector organisations in that local area. And it really is about big change for early years, and some of the work I'll refer to in this presentation. Our mantra is United for a Better Childhood. That's our kind of strategic aim. And if you look up Anti-Bullying Alliance this week, it's Anti-Bullying Week around the UK this week. And Anti-Bullying Alliance, they've made a video with Andy Days from CBeebies, and Andy Days and the Odd Socks is his band. And they've done a remake of Sham 69, If the Kids Are United. And it's amazing. Lots of children in various schools around the country have got together and danced and sent in their videos and so on. But they're adopting really part of the mantra that we say, united, together we're better. And individually we can do some great stuff, but if we can carefully curate our messages, we're more likely to be impactful. So it's a very respectful, united partnership. It doesn't come without its complexities, as you can imagine, because what we're really seeking for is sort of consensus, which means that at times we have points of difference and points of agreement, but we need to always agree on what's the top set of things that we're going to ask government, policymakers and others for change. Because if we have a small top set, we're more likely to get the change, because through all of our partners, we can all amplify and reinforce each other's voices. And you won't really see NCB as one of the noisiest campaigning charities, because we also do a lot that's behind closed doors, with the view that it's not about accolades for what we've said. It's more about our partners and our networks know the influence that we with them have brought to bear. And it's the change for children that's more important than somebody saying, oh, NCB said that or NCB did that. So sum that up, we bring organisations and people together and we deliver change, and it's all about social change and better childhoods. Better childhoods is really important to us, but we also, it doesn't make good kind of snappy language if we say children and young people and young adults. We actually take a focus on maternity through to age 25, and for quite a while we only really connected with the 18 to 25-year-olds if they were in the SEND cohort, so therefore young people with particular additional needs and vulnerabilities. However, we've rethought that, and we think that actually all young people are somewhere on that spectrum of needing additional support, and therefore our remit is up to age 25. So whether you're care experienced, a care leaver, just a young person who's wondering where to go in the current time, we think we are harnessing and listening to their issues. And we have a young NCB group of voices aged 10 to 18, and then we have older young people who are involved in our governance and sit on our board of trustees. So this is our model of working. We say that we do things that are about identifying and influencing to make the big change. So this is where we get involved in research projects, where we apply for funding and work with academic partners and other agencies so that we can get the absolute research and evidence to be able to stand firm about some of the things that we're saying. So it's not just because it's a trend or that we've heard other people saying it. If we've heard other people saying it and they've got research, we look at their research too. That is part of what we're doing. It's not all just about NCB research. So we identify what the needs are, what the issues are. Then our research and partnerships essentially then give us the authority and the credibility for us to influence. And it's not just us influencing on our own, it's in partnership with those other agencies. Their voices are amplified. We take partners into meetings, whether it's with civil servants, whether it's with ministers. We host something called the All-Party Parliamentary Group in Parliament. So we run that on behalf of government, and we work out a work plan, and cross-party parliamentarians come in, and it's all about trying to get children and young people's voice into the heart of government and put them at the centre of change. So that's the policy influencing and the research. And then because we believe that we have some good evidence about what works, we look in local areas at delivering programs, and that's where our programmatic side of work comes. So although we apply for funding streams, like I know that you do yourselves, get involved in funded activities, but it's always got to align with our mission. We don't just apply to it to do it because it's there. It's got to be what we believe is right. And sometimes we apply for things that we think we could make right if we could get a chance to do it. So sometimes there's contentious policy areas, and we think we could probably encourage the civil servants, policymakers to look differently, and that we think that we can involve partners and organisations who don't always get a look in to be part of what we're doing. We very rarely deliver anything just as NCB. We are nearly always there in partnership. And then finally, it's all about improvement. So the so what about doing something in practice is so that we can learn from that and that we can influence improvement. So we do a lot of workforce development. Across any year, we have many thousand practitioners that engage with short courses, training, policy briefings. So summing up, I'll be talking to you about some issues impacting on wellbeing, drawing on research, NCB's collaboration across networks, some references to Lambeth, and we also have, during the pandemic, conducted a family survey. So what we found about older children and young people in the pandemic, now this is through our Young NCB forum and through some of our work with other agencies too, and looking at what others have researched. It's been a sort of a pan-London piece of work, asking young people and running focus groups on behalf of the Mayor's office, asking, what the issues are and what the challenges are for young people. What we found is that, young people, particularly the sort of 16 to 21 age cohort, have really had tough times in terms of employment. And you just know that employment is about financial security and opportunities to lead the life that they want. But they've been far more likely than any other age group to go into furlough. And, that has been disproportionate to every other adult employed age range. Their disruption to education, I don't need to tell you, but it's just unprecedented disruption to their education. And this real specific worry there is, there's a real role that good schools, teachers and individuals within schools can play in supporting young people at tricky times. We know that they quite often have been an individual, have been there to support young people or to spot when there've been concerns and issues about them. And what we found is that there's absolutely an increased prevalence of poor mental health among young people. So particularly those older young people who are now have not been in school. And communities have told us that their biggest fear and what they believe is happening is that young people out of school are being recruited into child criminal exploitation. So they're feeling that their children are more vulnerable without the structure and the routine of school. And in areas where families are working hard to keep their children away from getting involved in county lines, drug activity, gangs, this is a particular issue. In safeguarding worlds, we call it contextual safeguarding, but I'm concerned about the individuals. It's, there are individuals, there are children and young people here. From the family survey that we conducted, now explaining this family survey, we were distributing through our Lambeth-based programme, distributing some food support, healthy eating boxes, vegetables and so on. And so we thought we'd ask families as we were connecting with them just what was going on for them. And we asked them a whole range of questions through a survey, because this was pandemic time. lots of interaction was happening online, not really happening face to face. So when you're dropping off a kind of food box, veg box, leaving a survey, a hard copy survey, but also inviting families to connect online or to have a conversation with somebody. There are a whole range of sort of preset things that we put down. So it was a bit of a giving people an opportunity to categorize. But these are the top worries that came out. You know, the top two here, families were genuinely worried about the future and just feeling like planning was even more challenging than it has ever been, and that they weren't able to think beyond just the next week. And that was equally as worrying as their well-being and mental health, and whether that was for the family themselves, whether that was for their friends. But they were the top two concerns. The others were less worrying. There was such a difference. If I said 30% of the respondents checked either both or one of those top two. And then others in varying levels said family and friends catching the virus was a big worry, understandably. And actually, doesn't it just tell you something about the families, that the concern about their own health, themselves catching the virus, was much further down the list? They were more concerned about everybody else than themselves. They were very concerned about their children, and there were several different options here, but it was their socialization, their lack of opportunities to continue mixing with friends. There's a particular issue for children with SEN and disabilities, where their friendship groups were often quite small and limited to those social contacts through their school, and they didn't necessarily have immediate contacts in their community, depending on where their school's located. But for those children, that was a particular issue. And that they're generally their child's development, just how much they were missing, and their education. And families were worried, obviously, about money. They did tell us about some of the things that they'd found were better. But they weren't saying it's obviously because of the virus. It's because they were at home and focusing on family life. So they spent more time with the family, and that was a positive. That they felt their wider connections with the family their own family were being reinforced. And some parents told us that was because of fear for the future and valuing relationships. And they revisited friendship groups, even if they had to do that on Zoom. Faith was important, and having time to reflect on relationships being everything. But families overwhelmingly had spent more time doing things with their children, and whether that was just playful, reading stories, sharing books, or getting outside as a family. However, we also picked up there are huge housing pressures. Do you know, the lack of private outdoor space was a challenge when families were in that lockdown period. You know, everybody knows that we have families that don't have their own private space. They live in, just shared properties without gardens and so on. But this was particularly, it just felt like a cruel twist that while families who didn't have outdoor play space of their own could get to parks, that the play areas were often just marked off and were available. That was really challenging. And parents talked about having to take the long route round somewhere to avoid a particular park or outdoor play space, because they couldn't really explain to their very young children, and they couldn't keep in check the older children that just wanted to go and climb on that attractive equipment. So that it was a big pressure. And families reported feeling more socially isolated than ever. And when we know that there's a real correlation between social isolation and that impacting on well-being and mental health, that really is an issue. And the survey was conducted over the summer, so we'd only had lockdown one. So this is really tough stuff after just a few months. Families talked about their own facilities and how they didn't always have the place that they would cook a good meal, not all those meals every day when they had all of the family at home. And, it turned out that there was some very limited facilities in, in shared properties, that families didn't necessarily have the full cooking facilities, which is a real challenge. And we found this out because we're delivering healthy eating, vegetables and so on that families would recognise. And we also had some cooking sessions online, which would be very informative for families about what to do. But when they haven't got the right equipment to be able to cook, that was, that was really challenging for them. So it felt like we're trying to do a good thing, but by giving them raw ingredients, they couldn't actually do the right things for their families. So it became an increasing pressure point. And, one of the points about multi-generational households, we gave Public Health England agency some feedback on their literature, where they said families where there was a contraction of coronavirus, that step one was to use different bathroom facilities. Well, we were looking at material with a view to making sure that it was appropriately available in community languages. And when you think this isn't even recognising the complexity of life, that multi-generational households don't necessarily have more than one bathroom. So what did the families look for in terms of support? So what they actually took up most of all was home-based activities for young children. Now, you saw on a previous slide about families saying that they spent more time playing and doing with their children. So you could say maybe it's not a surprise then they were looking for inspiration, ideas and access to resources. They did still ask and make contact about advice about their children's health or development if there were particular worries. And the food issue, I've mentioned, just feeding the family was a big issue, and families did ask for help, advice, signposting on that. Introducing first foods to babies, there's been quite good support, particularly in the Lambeth area where we've got this programme. And of course, that wasn't happening face to face, and health visitors weren't around, families weren't necessarily having that contact with each other. So advice on feeding babies came up, and also the whole issue about worry about housing. And even though the government were taking stock and making sure that it wasn't possible for landlords to evict families and so on during that period, just the fear had a big impact. So even if families were just being assured of the law, it didn't stop them from having the fear or to feel that their landlord wouldn't necessarily abide by the law. One of the aspects that we wanted to find out about was digital a good thing, or was it did it hamper access? And we found that actually most families said they did have digital access, but when we probed, we found it was mainly a device in a family shared, and when I say shared, it could be an adult, some older children, very young children. So if they're trying to use that for schoolwork and keeping in touch with some of the online learning, they were using highly expensive data, and they just didn't have the right devices for homeschooling. So some access was possible for almost all families, very tiny percentage where they didn't have any. And families actually shifted very positively to using a whole range of services online, from a standing still position where everything stopped. And then we were looking with every single service about what can you do? What can you do? Families were actually more willing than we thought, and were more positive about accessing, FaceTime, Zoom and Teams and different modes. But it was the biggest challenge was how to make that work where families needed some support, and whether that was kind of access support, vision, or signing, or community language. That was the biggest divide. So the longer this will go on, there's a cohort of families that can use the online and appreciated it. There's a whole cohort that we haven't yet found a good way of doing, unless the delivery service, the delivery agent, is entirely attuned with the family's needs and language, which means then there isn't a need for that third party interpreter. So a few of the system impacts, in some areas of the country, 40% of health visitors were redeployed to what were seen to be frontline services. Now, the fact that a lot of them didn't end up working in COVID wards is by the by. They were redeployed, they were moved from their health visiting task. Aside from the health visitors not being around to do some of the work, families actually were not necessarily taking up on appointments even when they were offered. And there's a massive drop in vaccinations, particularly the measles, mumps and rubella. That we got to over 70% take up. That's still not amazing. It's still far less when you think that that's available to 100% of children, and it's down to just over 40% right now. That's just a very concerning drop. After eradicating measles from the UK, we're on the verge of seeing that coming back in again. So measles, mumps, rubella, and all the associated health risks. Maternity, antenatal services all switched to telephone, and that parents still got the support, but it was all about the mom. And when we've worked really hard to get the dad along too, that's put really things back about 20 years during this period. And what is really startling is that there's a couple of reports published, one in September, one last month, one from the United Nations, one more local, which tells us that there's been a significant increase in stillbirth babies during the whole period. Now, this isn't being COVID symptomatic moms. This is not explained. So there's analysis happening at the moment about why. We know all of the factors that can lead to stillbirth. So there's a theory that maybe it's the lack of face-to-face, the lack of routine informal contact, that mean that there isn't somebody saying, oh, you're feeling like so, or while you're here, could I just check your blood pressure? So that is really worrying. So the rates were down to around 4 in 1,000, and they have doubled during the pandemic period. And there's particular hotspot areas. St George's Hospital is one in London. And, some of the obstetricians there have been very active about asking why. And we're already looking at a system where Black moms in particular do not have the best births, and there's a higher incidence of maternal and neonatal death. This is not a good statistic, but it's one that we have to get out there, and we have to ask the questions. And of course, schools, early year settings all closed. So what can parents do? We conducted some research not related to pandemic about all of the factors that make for a good childhood, and there's around 8 domains, and of those there's 2 that are particularly powerful. And the 2 that are particularly powerful that can be in the hands of parents, given the right support, is relationships. So family relationships, the relationship between parents, the relationship between adults in the household, and the relationship between the parent and the child. The second is the quality of the home learning environment. Would you believe that there's a strong evidence base that says that while play is great and all children should have the child-led play opportunities, that actually where parents have followed a particular program, I'm not naming a program, I'm saying a structured program for some of the what they're doing with their child at home, that's had better results than light touch. So actually that sort of blows some of what early years experts might say, which is it's all about play and child-led. Of course, that is absolutely vital, but there's evidence to say that children actually, particularly in communities where they haven't had all of the same opportunities and chances, make better progress if there's a structured offer that parents are using at home. And finally, this is a powerful message about just every child should have somebody that believes in them. Every child, every young person, whether they're a child at home, whether they're in the care of foster carers, if they're a child in care, every child need somebody that believes in them ultimately, and that there's evidence around the power of parental or the significant adult aspiration. Ideally, it's the parent, but it can be another child with that significant relationship in a child's life. So making relationships better. It's the parent also impacts on the parent-child. And the evidence shows that there's a direct influence with how the children learn, with their emotional and social well-being. It absolutely underpins their ability and their readiness to learn. And that security of knowing what to expect in a parent-child relationship in terms of boundaries, reward, love, that is absolutely just fundamental. So the quality of parent behaviours is seen to have a bigger impact than the parental education level and the family income. Say that actually because the research is quite specific about some parents as opposed to others. There's a whole evidence base about mother education level. Now that's a good predictor. However, on a day-to-day, the parenting behaviours are seen to mitigate anything, such as if parents haven't had educational opportunities. Their behaviours between themselves and how they interact with their child has a better impact on the child's outcomes. And money's important, but it doesn't count as much. So working on the harmony between parents, it doesn't mean resolving every aspect of conflict, but it does mean about looking at what parents agree is the right way to parent, what parents agree to do about what they can't resolve between them. And sometimes it's about learning how to argue better. And there's a range of services that are not stigmatizing parents and are really about reducing parental conflict, rather than saying it's a distinction between parents are harmonious or there's domestic violence. There's a lot in between, and there's a lot that can be achieved if parents get the right support. In terms of the home learning environment, we know again that there's a lot of evidence here about the impact that children spend a limited amount of time in education, and of course the quality of that is important, but that parents can influence more than they might believe by really making sure that what happens at home, we call the home learning environment the home, but that's also the wider family, the support that comes from community, and what happens outside the home, such as the opportunities, you know, that sort of rich range of what are free to go to, you know, museums and libraries when they're open, parks and opportunities. Those additional experiences are what Ofsted, when they're going in to inspect in settings, they call that cultural experience, and they mean that in a very broad sense. It's those wider opportunities. And top of the list is parents communicating with children. It's the whole sentence. It's extending a child's language so that you repeat and mirror and extend their language, that you're modelling good speech and language at home. And it's a technique that can also be applied with older young people too. And I'm being, you know, realistic here. I have my own now adult children, so I know that the teenage years were not always the most highly communicative. So the home learning environment, parents can genuinely influence that and can truly bring impactful change on well-being and achievement. There's some research about aspirations, and the research was actually conducted with parents in, it was Birmingham, Glasgow, university-led piece of research, and parents were compared, you know, in a very affluent community and a less affluent community. Parents that had lots of opportunities, they maybe had university and A-level experience, and it really demonstrated that working with parents to believe in their children and taking a it's psychotherapy influenced approach, really truly believing in their children's worth, well-being and level of achievement, what could be possible in life, meant that the standard is that parents will often say, if they're asked what they want to achieve for their child, if they left school without any exams, it's to be at school, take some exams. If they left school with some of the most basic exams, it's that they might go to the next level. If they'd actually maybe taken A levels or a vocational course, maybe they want their child to go to university. And after working on aspiration, really focusing on the strengths of children, what could be possible, what they could achieve, and their own impact in there as parents. Parents were revisited and they had leveled up their aspiration 2 levels or more. So if they'd left school without exams, they then wanted their child to go to university. That's a very simplistic explanation, but it shows that there's truth in that. If a parent believes in their child and gives them the opportunities and is the pointy-elbowed parent at times fighting for those opportunities where they're not always there, that it's much more likely to give their child the pathway and the opportunities that they deserve. And just sum up on some NCB priorities. So this is what we are collectively asking government for. We're asking them to essentially to keep schools and earlier settings open. We believe that with the right careful actions, that they can be the safest possible places. We've heard about the issues about older young people being out of school, the impact on their education. We're really appealing to government to do that. We're involved in various working parties and groups that that talk about the risks and so on, and that's, I think, absolutely just top of the key. We think that the inequalities around special educational needs and disability have been amplified during COVID, but actually the issues were still there. Despite the work that we've been doing over decades, there's still a long way to go with fair and equal access in health and education. And we're focusing at the moment on encouraging families, particularly in the early years, to take up the entitlements that are available to them at age 2 that aren't available to all of the population. And we need to make sure that settings are better equipped to support children. We're trying to tackle the high level of exclusions that happen when children get into reception, and it's primarily attributed to behaviour, but it's usually lack of understanding about a child's developmental needs and where there's early indication of special educational needs. Money is a big thing. We're working with the End Child Poverty Coalition, a number of other charities, and really speaking out about not just saying fix it government, but with some practical ideas about and how much to add into a benefit system, what changes to bring about. The inequalities in health and education, particularly for Black, Asian, minority ethnic communities, we know from the news agendas regarding deaths in COVID that there's been a disproportionate number of deaths from the Black, Asian, minority ethnic community, and any research so far hasn't indicated why. You know, there's suggestions that it's particular workforce cohorts, so the doctors, the nurses, and people that are working in more vulnerable frontline roles. But that isn't the only reason. From the work that that I've been doing in our Lambeth programme, we did quite a bit before even setting that programme up to disaggregate data. You know, it's not commonly available as a broken down data set. You have to get in data specialists and you have to interrogate data to find that a lot of the information that we get about inequalities, it's like a smoothing, it's a top line. And when you drill down into it, you find that the differences between population groups are stark. So therefore, we are challenging government to make sure that data is better, because the data is very powerful in arguing for change. If it's all smoothed and you can't tell which population group has got greater challenges, then it's harder to make the argument because it's on anecdote, observation. Data is powerful. And would you believe that at the moment on death certificates that ethnicity is not recorded? So that's one of the reasons why it makes it quite a challenge to be able to really interrogate what's happened during the pandemic. Digital exclusion, I've mentioned some of the challenges there, but saying that there should be a basic entitlement for young people to be able to continue their education and actually do the best they can. And emotional well-being and mental health prevalence rates, I mentioned that they'd increased. They've actually increased, particularly amongst young women. That's statistically. So the stats are that it's, white young males. Then during pandemic, there's been an increase in young women across all communities. And then suicide rates are, there's suicide makes no, choice. There's no difference, actually. It's, that's spread kind of equally across population groups. And as you get into the older communities in adults, it's Black families and communities where there is poor mental health and well-being. And finally, it's not just the ask, it's the way of doing. We're saying children, families, communities have to be at the heart of change, and that anything that's new should be influenced by the voice of those that are expected to benefit. And whether that's children, whether that's young people, whether that's specific communities, so that they feel that they own the solution and that their assets and their talents can be part of that too.